65-year-old man is found to have iron deficiency anemia. He has had no cough, abdominal pain, melena, or change in bowel habits, but reports anorexia and 5 kilogram weight loss in the last 2 months. Rectal examination shows guaiac positive brown stool, 3 centimeter mass is found on colonoscopy. Biopsy shows pleomorphic cells with large dark nuclei forming irregular crowded glands, some of which contain mucus. Imaging studies reveals multiple mass lesions in the liver and lung. This patient's neoplasm most likely originated from which of the following location? The important thing in this scenario, Shabab, that will help in differentiating the site, first is that we have a liver metastasis. Okay, we have a liver metastasis and the lung indicating that the multiple masses lesions. So most commonly, the origin of this mass is in the intestine. So in the intestine, among these, we have the ascending colon, we have the rectosigmoid colon. Now, we need to differentiate between what is more common to happen in the right side of the colon from the left side of the colon. And we could see in the note that the right-sided ascending colon cancer is usually large and bulky, protrude into the wall, and bleed. That's why the patient will present with iron deficiency anemia, because there is bleeding and occult blood loss. On the other hand, left-sided, which is rectosigmoid, as example, left-sided colon cancer is smaller, infiltrate the wall and encircle the wall, because the right side colon is larger in the caliber compared to left, so left colon cancer can cause obstruction. So the patient may present with distension, nausea, vomiting, and bowel. Also, in addition to that, we have bowel changes. So be careful in differentiating the features of the right-sided colon cancer compared to the left-side colon cancer. Also note in the scenario that the features of adrenal gland tumor, lung, or prostate, they have additional features that are not present in this case. As example, adrenal gland tumor will cause hormonal changes, lung will cause hemoptysis, and prostate patient should have urinary symptoms.